Dental care for anxiety and mental health. Introduction to our topic. Dental anxiety and mental health concerns can make it challenging for many individuals to access the oral care they need and deserve. Feelings of fear, restlessness, stress, and past traumatic experiences can cause clients to postpone or overall avoid care. Over time, this can negatively affect these individuals' oral and overall health. As a result, these individuals are considered a vulnerable or a high-risk population in healthcare that requires extra attention and a client-centered approach. This topic is relevant to the dental hygiene process of care because as hygienists, we are responsible for tailoring our care to be more client-specific, making the environment and oral care feeling comfortable and safe for all populations. By identifying barriers to care, we are able to create a more compassionate, trusting, and positive dental experience. The advocacy goal of this project is to address these gaps in accessible care when it comes to the needs of individuals with dental and mental health challenges. By identifying barriers and promoting supportive strategies, we can reduce these barriers and create more efficient healthcare to those in need. As dental hygienists, it is our goal and oath to continually be growing in our field and provide better and educated care.
This slide looks at who is affected by dental anxiety and mental health concerns. The population includes people who have anxiety, trauma, PTSD, depression, or other mental health concerns. For some people, going to a dental appointment can seem really stressful or overwhelming, especially if they have had a bad experience before. These feelings can make people avoid or delay dental care. Some may feel embarrassed about their teeth, worried about being judged, or uncomfortable talking about their mental health. The stakeholders include the clients and their families, dental hygienists, dentists, dental assistants, mental health professionals, dental education programs, and physicians who may be involved in their care. This is important because mental health can affect someone's motivation to brush, floss, and attend appointments. When care is avoided, dental problems can get worse and they may lead to pain, infection, and other health concerns.
Now we're going to look at the problem and the thesis. So we see a lot of anxiety, trauma, PTSD, and some other mental health challenges that can create barriers for dental care. There's also fear and stigma and the negative past experiences of people, which often lead to delayed or avoided treatment. There can also be poor access to care, which can result in worse oral and overall health outcomes. Healthcare providers sometimes are not working together to improve healthcare for the population, and there's also a big chance that there is medication that is impacting someone's oral health that the patient may not be aware of. It's important that we advocate for compassionate, trauma-informed dental care because it can help improve access to oral health services, reduce barriers to care, create a safer and more supportive dental environment, improve overall health and well-being for vulnerable populations, and find possible negative impacts of medication on the oral health.
What we found from our articles of research. We looked at 3 different articles in relation to our advocacy topic. All 3 articles provided proof that anxiety, trauma, PTSD, depression, and other mental health challenges can create significant barriers to accessing regular dental care and maintaining proper oral health. An important finding from the research was that many individuals suffering from anxiety or dental fears and phobias avoid dental appointments because of fear, shame, embarrassment, previous traumatic experiences, or concerns about being judged by healthcare professionals. This leads to a pattern of irregular care and increased anxiety in relation. People from these vulnerable populations may struggle from a variety of different mental health challenges. This can often lead to a negative effect on their oral health habits, motivation, and attendance to regular dental appointments. In the research, it was shown that many patients with mental health difficulties lack proper oral care and health, providing a need for intervention in this advocacy issue. Additionally, many articles pointed out the need for trauma-informed care, compassionate communication, trust-building, and patient-centered approaches. Using these methods identified ways to improve patient experiences and increase willingness to seek care if struggling from mental health challenges, fear, trauma, or phobias. Cognitive behavioral therapy, or CBT, was found to be one of the most effective interventions in the research. In an article, it was proven that CBT therapy reduced dental fear, improved treatment attendance, and increased the patient's willingness to maintain regular care of dental appointments. Research also showed that there is a proven stigma surrounding mental health and how it can prevent patients from discussing their concerns or accessing the care they need due to fear of being judged by healthcare professionals. It's also important to note that medications used to treat mental health conditions may contribute to oral health conditions, increasing the risk of oral complications or oral disease, and it's a large majority of the population that's unaware of the impacts of the medication that they're taking in relation to their oral health. How the evidence from the articles and research we did supports our position for our health advocacy topic. The evidence we found supports our beliefs that there is a need for our advocacy topic pertaining to compassionate, trauma-informed, and patient-centered dental care being more accessible for those who suffer with anxiety or mental health challenges. The research supports communication, emotional safety, and trust building can reduce anxiety and improve patient comfort, in return, improving attendance and oral health. The articles prove that anxiety and mental health directly impacts oral health, oral hygiene behaviors, oral health outcomes, and access to care. Importantly, it was highlighted that there should be an increase of education for dental professionals regarding trauma-informed care, mental health awareness, and communication strategies. Additionally, the research we found talked about how important of a role a dental hygienist plays in patient education, health promotion, identifying barriers to care, and creating a supportive and safe clinical environment that impacts a patient's experience and oral health. So, what are some of the barriers and challenges that might come across when trying to do this advocacy topic? Dental anxiety and fear of getting treatment could lead to lack of care and lack of participations in research. Previous traumatic dental or healthcare experiences will lead to the avoidance of dental offices or the inability to provide some treatments to clients. Stigma surrounding mental health conditions means that patients may not feel safe or comfortable to receive care if they don't feel understood. Fear of judgment or embarrassment about oral health status, especially if they haven't been able to receive oral care for quite some time. And conditions like PTSD, depression, anxiety disorders, and other mental health challenges can all cause these barriers because mental health is not linear. So we might see different barriers and challenges from different groups, but we have to keep in mind that these are all things that the clients may face, and we need to be ready to explore options for helping them. Additionally, some patients may face financial barriers and difficulty attending their appointments. Medications may have side effects that negatively affect oral health, and many clients are unaware or unable to stop some of their anxiety or mental health medications, and they just need proper coaching for oral health prevention in regard to oral conditions the medications may be causing, or we may need to have connection with their doctor to figure out maybe a better solution. Lack of communication between dental professionals and mental health professionals, limited mental health training and protocols within dental and dental hygiene programs leads to improper personalized care or understanding of what those clients may be specifically going through in that vulnerable populations, and limited research available on trauma survivors and individuals with severe mental health conditions. We need to continue to grow and develop in our field to improve care so that these barriers and challenges aren't making such a big impact when we do provide care to these patients.
So, what change is needed? In order to help improve the treatment of clients who experience anxiety and other mental health disorders, changes can include an increased compassion when treating clients who experience mental health and trauma-related concerns or disorders, because we aren't always aware of certain triggers a client may experience. We could also use trauma-informed and client-centered language and care. And we can also have more mental health training for dental hygienists and other dental professionals within the field, just to ensure and improve our general knowledge with mental health disorders. And then we can also increase collaboration between dental health professionals as well as mental health care professionals to improve client care and comfort. So who's involved in this? I know we already kind of touched on it, but this will go a little bit more in depth. So clients who experience anxiety, a history of trauma, PTSD, depression, or any other mental health disorders, as well as the dental health professionals, so dental hygienists, dentists, dental assistants, and dental administrators, also the mental health care providers and professionals, and the education institutions that would aid in the improvement for better learning opportunities for dental professionals. So, what are the next steps? The next steps for improving mental health client experience can include more trauma informed care, as mentioned before, as well as compassionate client centered language strategies within the dental clinic. We could also increase more awareness regarding mental health disorders within all the dental programs and create a supportive and understanding environments for clients that can contribute to the reduction of stress, fear, stigma, and emotional distress when they're at the dental clinic. We can also implement and develop a stronger relationship and collaborate better between dental professionals and mental health care professionals, as well as advocating for accessible care options for clients who experience anxiety or PTSD, depression, a history of trauma, or any other mental health disorders so that we can improve the dental field. So here's kind of like a list of strategies we can start to use and incorporate when we are seeing clients who experience anxiety in the clinic. So to ensure we are communicating effectively, supportively, and compassionately, we can use language that includes trauma-informed, as previously mentioned, and client-centered, open-ended questions, active listening, empathy, collaborative decision-making with the client, positive reinforcement, and trust-building responses with the client. So here are a couple examples of supportive communication with the client. So if a client expresses anxiety at the dental clinic, we can make sure we use active listening and ask them comforting questions to improve their experience. So if a client expresses that being at the dentist makes them very anxious, we can let them know that we appreciate them for telling us. And we can then ask them open-ended questions, such as what makes you the most anxious. And then that can help us determine how to ensure the client is the most comfortable when we're treating them. And then another example of supportive communication could be supporting a client who may experience embarrassment regarding their oral health status. So if a client expresses that they hate coming to the dentist just because their teeth are gross or they're not happy with how their mouth and oral health is, we can respond by saying there's no need to be embarrassed and that we appreciate the client for coming in today and that we'll work together collaboratively to improve their oral health as well as ensure that they're satisfied. So now let's take a look at some real world scenarios that we came across during our research topic that are beneficial and how we would handle them and the outcomes.
Scenario 1 focuses on a 32-year-old female who has severe dental anxiety due to traumatic dental experiences as a child. She has not seen a dental professional in 8 years and appears nervous and tearful during her appointment. Her main barriers include fear of pain, lack of trust in dental professionals, and anxiety about being judged for her oral health. As dental hygienists, it's important to use a calm, non-judgmental, and trauma-informed approach. We can explain procedures before beginning, encourage questions, allow breaks when needed, and involve the client in the treatment decisions. By creating a safe and supportive environment, we can help build trust, reduce anxiety, and increase the client's willingness to seek regular dental care in the future.
Another example of a real-world scenario we're going to look at in this second case study is mental health challenges affecting someone's oral health. So here we see a 45-year-old male client who was diagnosed with depression and anxiety. He has reported difficulty maintaining his daily oral hygiene, takes medication that causes xerostomia, known as dry mouth, and frequently misses dental appointments. Some barriers are low motivation for self-care, medication that has side effects which increase oral health risks, embarrassment about his oral health condition, difficulty attending appointments regularly. For a dental hygiene approach, we would provide compassionate and supportive care. We would also avoid judgment regarding his oral health status. We will offer practical oral hygiene recommendations, educate him about managing his dry mouth, and schedule shorter appointments and provide encouragement throughout the appointment. The outcome would be for improved oral health knowledge, have an increased confidence and comfort in the dental setting, better attendance and engagement in preventative care, and lastly, improved oral health outcomes over time.
Conclusion. Dental anxiety and mental health concerns can play a huge role in limiting access to regular dental care and visits. These challenges often result in delayed treatment until dental issues are too late, like oral lesions, decay, or bone loss. Delay in treatment can lead to a decrease in systemic health and overall well-being. As dental hygienists, it is our responsibility to advocate for high-risk populations and recognize where these areas are. By raising awareness to this topic and learning strategies to help provide care to individuals with dental anxiety, we can promote a more inclusive environment for dental care and provide more accessibility to care.
Thank you. We hope you learned something.
So here's a list of all of our references that were used during the research phase, and it also includes all of our articles as well that was used in our essay.